alongside with FID support, we were able to do the world's largest randomized control trial on children's mental health and well-being to understand what are the causal connections between children's well-being, our program, and their ability to learn and do literacy and numeracy. RCT measured 3 buckets of outcomes over 2 years with over 30,000 children. The first was learning outcomes, so we measured numeracy, literacy, and cognition. The second was social-emotional learning outcomes like grit and resilience. And the third was mental health outcomes like anxiety. In terms of learning and cognition, those are our most promising results. We saw that our program added up to 16 months of additional math learning gains amongst our children, with some subgroups going up to 26 additional months. We saw in some subgroups our learning outcomes around literacy going up by almost 12 months, additionally apart from what the children already learn. We are also seeing children's cognition increase, which means their ability to critically think or recognize patterns has gone up significantly. In terms of social-emotional learning, we are seeing some promising results in grit in year 1, which was very interesting amongst some subgroups. And lastly, when it comes to mental health, we are seeing some interesting decline in anxiety amongst children. We are seeing in the most vulnerable groups of children like girls and children with high baseline levels of anxiety going as low as 21%. This is very important because most of the children that we work with would erstwhile unfortunately never have the chance to access mainstream therapy or counseling and mental health support. So this at scale in an upstream level is extremely significant for our children. So the 2 big learnings we know from the RCT, the first is that now we know that well-being unlocks learning. We know that a daily well-being class leads to children being and feeling more relaxed. Relaxed children focus and think better, and when children are thinking better, they learn better. The second thing is that as per JPAL's cost effectiveness analysis, it is costing our state government partners less than 30 cents per child per year to implement the program. This is extremely affordable for governments, not just in India, but around the world in low and middle income countries, which makes our model very, very promising at scale and also gives us confidence in our scale strategy. So going forward with the RCT, we hope that we are able to make sure that this program reaches and impacts even more children and hopefully reach our goal of impacting 30 million children by 2030. But more importantly, we are able to continuously and rigorously produce better evidence in favor of children's well-being to know that well-being is not a good to have, it's a must have. The readiness of the child is extremely important in their success in the future.